हाँ सर बोलिए।
My name is Dr. R. Balsubramaniam, and I am the founder of the NGO called Swami Vivekananda Youth Movement. This is basically an NGO which I started 25 years ago. Today it's grown into a large organization working in the sectors of health, education, community development, and training, research, advocacy, and consultancy. Its head office is located in Mysore, but we work across Karnataka in all the districts. The projects reach out to nearly 6 million people across Karnataka. Today, possibly I'll speak specifically on issues of pertaining to Mysore district. Now, Mysore, as all of you will know, is a district which is very famous for its heritage and culture. But though it's well known and it was the center for the Maharaja's rule, is where Karnataka's capital was earlier. Today, it is the development indicators don't speak very highly of Mysore. Now, if you look at poverty issues, I'll go sector by sector, but we'll start with health. Now, in the health sector, specifically, issues of rural health and urban health are different. Urban health mostly are provided by urban health centers within the city of corporation of Mysore, which is a much far inferior, unlike what people think, to what the rural health care in Mysore district is all about. Now, Mysore has also got a unique problem of having a lot of forests, and that means a lot of problems of indigenous people, the tribals, where access to service is a great challenge. Since our work mostly involves the indigenous people, my focus will be a little more about them. Now, Mysore district has got two national parks, major national parks, the Bandipur National Park and portions of the Nagaroli National Park. It's a district with the major river Kaveri flows, which is a river of contention between Karnataka and Tamil Nadu. And every time there's a problem of river dispute, that's also affected. So I'll also be talking a little bit about the education status, and I'll try to sort of speak as generically as possible. Now, Mysore was known for its education till recently. During the Maharaja's period, in fact, the oldest medical college was in Mysore. The first power producing plant was in Mysore in India. The first All India radio was in Mysore. With all these kind of achievements 70, 80 years ago, post-independent, Mysore has been steadily neglected, though it's very close to the capital. Now, around people below the poverty line, technically as per the NGOs, is around 40 to 45%, though the state aims something like 28 to 30%. Now, being predominantly rural and agriculture based, Mysore is known for its irrigated lands with a lot of rice being grown, it's a paddy belt, and also areas of cotton. Now, cotton, the same problems that cotton farmers face across India, the farmers of Mysore district also face, with problems of insecticides, problems of bad seeds, and then the falling rates of cotton. Luckily, we have not had too many farmer suicides in Mysore, though we have had a few of them, especially related to cotton. Now, education, the education indicators around, these figures might have to be re-verified because it's a little old, maybe a year old. As the Sarva Shiksha Abhiyan, I think it's close to, they say that its enrollment is close to 94%, but we don't agree on it. They claim that around 6,000 children are out of school, but we claim that there are much higher children out of school. As usual, NGO figures and government figures don't really match. Huge amounts of money is being spent from the Sarva Shiksha Abhiyan, but there's again issues of governance and corruption, which is rampant. And we also have close to around, the claims are, the literacy rate is close to around 70%, which I have my own doubts. Amongst the different taluks in Mysore, which are 7, unfortunately, it's Mysore and Nanjangud, which is supposed to be the worst off. The city of Mysore being so close to the Mysore taluk, that itself is bad. And healthcare, again, the infant mortality rate is very close to national, slightly better than the national average. I think we're around 56 to 58. The maternal mortality rate also is very lower than the national average. But all this doesn't still ensure healthcare being available to all people at all the time. Now, though the state has started now under NRHM 24/7 PHCs, they're only on paper, but many PHCs still don't have medical manpower. One good thing that's happened recently has been the state starting this concept of 108 is an ambulance, which is across rural Mysore. You have ambulance service available now, so at least patients being transported to nearest health centers are now it's easier than before. Now, endemically speaking, certain pockets of Mysore have problems of malaria. There's a very small isolated pocket of leprosy, but otherwise generally most of the vaccine preventable diseases are under control. We have occasional epidemics here and there that's reported, but it's very manageable. Mysore does have a problem of HIV/AIDS, which is because the tourist center that it is and the kind of transiting tourist population. The HIV/AIDS prevalence also is close to what the national averages are, slightly higher. In Karnataka, it's Mysore and Udupi which are the highest. So Mysore is also one of the higher ends of the HIV/AIDS problem. The kind of NGOs working in Mysore are diverse. We have hundreds of NGOs. Some of them extremely good. Some of them, as usual, mediocre. Some of them pathetically bad. But it's heavily crowded by NGOs. A lot of good work happens. A lot of advocacy work, a lot of public policy work is also starting from in Mysore. Mysore city proper is getting rapidly industrialized, and all the problems of pollution, etc., coming into Mysore city also. We also have issues of river beds being taken away and land being encroached. All the problems that we see in urbanization also happening in the city of Mysore. In the rural context of Mysore, democratic participation is something which is, I would say, it's a mixed bag. One side we have political setups right up from the village level and participation from the panchayat level, though the Gram Panchayat is considered to be completely apolitical. In reality it is not. It is reasonably political too. At different levels participation is high, women's representation also is good enough, but one of the bigger challenges, I think, it's not just Mysore, the whole of Karnataka, is the question of corruption. There are also a few of us working in the sector of right to information and trying to ensure that right to information is used as a tool to fight corruption, which is also beginning of late, the last few months. I would actually prefer if you can ask me specific questions, which will be easy for me to answer, because I think speaking generally, I can keep speaking and nothing specific can be spoken, but if there is a specific issue that you want to know, that will be easy for me to answer.